so much for coming out. We're going to be going through our psychology of the A-EMCA today and how to crush the A-EMCA exam. So obviously it has a lot to do with your own information, your own knowledge base of the material, but also as Joel was kind of explaining to you all, it's also a lot about how you're going to interpret these questions, how you're going to attack these questions, and how you're going to really go through your preparation process. Okay. So first we're going to talk about the test composition itself. What are you really going to be expecting in the A-EMCA? I'm sure you guys have spoken about it. Your professors and preceptors may have told you about what to expect, but we just want to make sure that you're not walking into something a little bit blind or a little bit crazy. A lot of people have never experienced the length and the kind of intensity of an exam like this. It's something like the intensity of the MCATs or the bar exam, kind of those big certification exams that everyone's heard of. This is just a little bit different than what you may have faced if you've only gone through the college preparation pathway. You may not have seen something like this. So just understanding that it's a 2-3 hour examination periods within one day. So you'll have a morning exam and an afternoon exam. Each exam is comprised of 120 questions. All of the questions are multiple choice. Okay, so all of these questions are multiple choice. However, multiple choice doesn't mean easy. You're going to be able to narrow it down in 2 seconds, kind of multiple choice. You may be experiencing different things, and we're going to explain the question types that you're going to see. But if you haven't heard the term multiple multiples, you are going to get familiar with them throughout the presentation today, and you're going to get very familiar with them throughout your examination. Okay, so the types of questions that are going to be on the EMCA, these are 6 different question types that you are likely to see. First one is a factual question. A factual question measures the applicant's ability to recall specific facts about a topic. Next, you're going to see application style questions. So these require the correct application of knowledge to a specific situation or patient condition. So they want to ensure that you can not only read and understand what's going on in the scenario or in the situation, but actually apply the specific piece of knowledge that you have gained throughout your education and experience. So not only do you have to have the knowledge right, but you have to apply it in the right way. That's what this is really going to be asking you for. Next, you're going to have judgment questions. So they're going to measure the applicant's ability to decide on the best course of action in a given situation or scenario. So it's choosing what really should you be focusing your energy on, in what way should you be responding and reacting to the way that they're presenting your patient. 4 is interpretive questions. So determining the information that's given within a scenario and understanding the significance of that information. So they may give you a scenario that starts off with, at 4 a.m. on a cold, snowy winter day, you're going to respond to a home at 143 Mulberry Lane for blah, blah, blah. A lot of that information might not be extremely significant. However, they're going to put it in there in order to ensure that they can help you paint a picture. So read over it, determine what they're kind to ask you, and then understand what the significance is of each piece of information. If you feel that you can just get rid of some of that information, then that becomes your decision. However, they want to make sure that you can pick and pull at their most appropriate information to answer the questions that will follow. Next, you're going to have rationale questions. Rationale questions are going to test your ability to explain findings within the assessment itself, patient clinical findings, as well as managing potential legal concerns. Okay, so management of the patient and managing any legal concerns that you may see. That includes documentation, a rationale for why certain things may or may not have been done. As well, you may see what are being currently referred to as ethical style questions. So questions that are going to ask you, how would you react to this situation? What would you say to this family member? How would you speak to this patient? In which way would you handle a conflict with your partner on a certain patient type? So you need to be prepared for those hard skills, testing your patho knowledge, as well as the soft skills that you may be running into when you are on the road that are being tested on more and more often. Finally, we have prioritization questions. So measuring the candidate's ability to prioritize the most necessary actions required or interpret the most important clinical findings in assessment to ensure adequate patient management. So those are the 6 question types you're going to see. And Joel just wants to pop in here.
Yeah, so this is one that comes up, and this is something that when we're teaching the A-EMCA prep, whether it's the formerly in person, hopefully we'll come back to that, but whether it's the in-person workshop, weekend online workshop, or if it's through the A-EMCA prep online subscription, the rationale questions I find are really, really difficult. And the reasoning for this is that it largely depends on the tone with which you read the question. And the tone with which you read the question will ultimately be influenced by your mood and by kind of how you're feeling at that time. So a simple example would be a question could ask something, maybe if you had an unsuccessful resuscitation effort, what would you say to the family? And the question could state plainly, we've tried everything we can do. Unfortunately, they've passed. Is there anything we can do for you? And you can read it just as plainly as that. And given the context, whatever the other options are, that may be a perfectly reasonable answer. But if you're reading it and you're rushed because you're panicked because it's getting down to the end of the exam, maybe you spent too much time on another question, maybe you'd read it in a rush saying, we did everything, they're gone, sorry, is there anything else we can do for you? And it's even though they're the same words, it's very, very different context. So when you're reading these questions, try to make an effort to read them very flat, take them at face value, and try not to really infer any subtext because it's not really there. This isn't a creative exam. Just try to read it matter of fact and use your best judgment against what you would expect, because a lot of these you can't necessarily study for these. You may have cues that point you towards something that's med legal or something that's ambulance ops, but ultimately it's a what would you do question, and there's no studying for that. We'll know all our doses, we'll know all our protocols, but what would you do largely comes down to your character.
And some of these questions can also really be more challenging for those who may be doing their precepting and consolidation in a smaller or more remote service. Some of us who have ridden out in larger centers may experience a way more broad variety of calls. And obviously any student that's in their preceptorship is thinking, okay, I want to get that trauma. I want to get that VSA. I want to get these high acuity calls so I can really practice my skills. But those people also take it for granted how many mental health calls you may do, how many opiate calls you may do, how many initial interactions you may do with people that you don't quite see all the time. That's really going to help develop your soft skills. So soft skills are so critical for this job, not only for your hiring, your interviews, your hiring scenarios, but really in the EMCA as well, because they're learning that we need to also be testing soft skills in certain situations. So you have to be prepared for these types and styles of questions to come up.
Kyle, can I just
please? Yeah, please.
For prioritization questions, in scenarios on the road, you can multitask. You have all these hands and all these people to help you. But in the EMCA, you need to actually break it down and choose what's first. So you may say, oh, I can do X, Y, Z all at the same time. Like I check my ABCs and my partner can do this for me, but you need to actually choose what you're going to do first. You have to actually break it down. You say you'll think to yourself, I can do this, this, and this, but actually you have to choose. You have to make a decision.
Absolutely. And that's where we get to the description of multiples. So this would be a great time to just, while we're in question types, before we get to the 2 styles of questions. If you haven't heard of what a multiple is, we are going to be doing some later on. We'll retouch on it if this isn't a clear explanation for you. But you'll have a question, and then underneath of it, you'll have 4 to 5 choices that are usually labeled I, So Roman numerals 1, 2, 3, 4, 5. And then you will choose one of the answers, which will be A, B, C, or D. So in A, B, C, or D, it'll say something like 2 and 3, 2, 4, and 5, 1 and 2, or 1 only. So then you have to actually go through each of the 5 answers that they gave you and choose which of those are actually correct to get your final answer. So it's not just which of the following best describes bronchoconstriction, A, B, C, or D. It'll be which of the following is bronchoconstriction, 1, 2, 3, 4, 5, and then you have to go through each of those and be like, that is accurate. That is accurate. No, I don't agree with that one. I don't agree with that one. Okay, I think it's 1, 2, and 5. And then you'll see if 1, 2, and 5 is an answer, and hopefully it is an answer, because there's nothing worse than getting through the question. You're like, yeah, I'm pretty sure it's 1, 3, and 5. And then that's not one of the answers that they give you. And you're like, okay, I have to go back to the drawing board. So that's one of the strategies that we're going to hopefully help you with just a little bit later today as well. Okay. So that's what you're going to expect on the A-EMCA the A-EMCA exam itself. So that's literally just that quick test description. Okay. One of the keys to performing well on this exam, and I can't stress it enough, is preparation. You can know what to face. You can know how to do multiples well. You can be a king or a queen at taking these multiple question exams. But if you're not prepared well, your brain, your body, and your ability to actually perform it's going to be hindered. So we want to make sure that we can do some of the best things to allow ourselves to do well. So always remember that there's a right and a wrong way to study. Studying doesn't mean you open up your binder from PCP school and say, I'm going to study cardiac today. And then you start at slide 1 of cardiac, spend 5 hours reading all of the slides, and then say, wow, I really studied a lot of cardiac today. I guess I'm done after my 5 hours. That's not studying. That's just rereading to play your own self and play a game of, I put in all these hours of studying, I'm now prepared. Studying is taking the time to go through whatever material, whatever topic it is. And then once you get to information that you don't know, that is you now relearning and understanding a topic. So if I know a lot about the conduction pathway and SA nodes, fires at this rate, all that stuff, and I'm reading about sinus rhythms and then junctional rhythms, but I already genuinely knew that stuff before, I'm just wasting time looking over stuff to make myself feel good. Be like, oh yeah, it is 60 beats per minute, 60 to 100. Cool. Yeah, I really know this. That's not how we want to spend our time studying. We want to go through the things we know very quickly. And then when you get to something that you're not confident in, that's where you want to take the time to review it and actually relearn it, or possibly learn it for the first time, depending on if you're paying attention in class or not, because it's really easy to get distracted when you're doing everything on PowerPoint and Zoom. So if you didn't learn it originally, take the time to really digest it while you're studying. That's how you get an effective study session. And you really want to try and make sure that you're studying the high acuity topics in a testing environment. So that doesn't mean you can never go to Starbucks with some music on. Like, a lot of people love to study that way. I loved to study that way. When I'm saying study in a test environment, it's if you're going to be doing practice questions and trying to get into the mindset of doing testing stuff, do it in a testing environment like your bedroom. You're not going to have headphones on. You're not going to be kind of eating a snack while you're doing it. You make a simulation, do test questions, see how you do. Don't Google the answers that you don't know just to have the right answer there. Actually test yourself, see where you're at, and then use those wrong answers as a diving board. Okay, so attempt practice exams in a testing environment. Next, we really want to make sure that we're breaking down our study sessions. If you only think that you have 6 hours to study for a specific topic, you don't want to go and sit down from 1 to 7 p.m. at a Starbucks and think that you're going to digest as much as you would in multiple smaller sessions. Your brain is just not designed to be on and actually comprehending for that long of a period of time. And 6 hours is just an example. There's research saying that even when you get to 3 to 4 hours of continuous, You're just not retaining things anymore. So if you're going to be studying, break it down into smaller sessions. I know it's easy for me to say, not knowing everyone's personal situation. I'm sure people have jobs and rideouts and childcare and anything else that's going on, but it's just been shown that if you have the ability to do so, multiple smaller sessions is going to give you a much better result. And also, taking small breaks while you study is absolutely key. So there's a 25 and 5 rule. So if you do every half an hour session that you have, really do 25 minutes of real studying, like we were just talking about. So learning a new topic or really diving deeper into a topic to thoroughly understand the principles and the real patho behind it, or what you didn't understand before. And then take 5 minutes to scroll through Instagram. Take 5 minutes to sit back, stretch, refill your coffee. Take 5 minutes to go and hug your little one. Do whatever you want to do for that little time. Make it a full mental break, and then come back and dive right back into the real studying.
Just make sure
Third
it's
one,
5 minutes on the clock and not an Instagram 5 minutes that really
Yeah.
takes up like 45 minutes real
yeah,
world.
it'll turn out being 25 half an hour rule, because everyone knows how quickly you can start scrolling through that. And then you find out what Becky did on the weekend, and you have to make sure that she knows how great she looked in that dress when she was drinking that thing on the dock in the summer, like, and then you just turn into everything, right? So
For the gram though.
the gram. So the third thing, cramming is not effective. No matter how awesome you were in high school, trust me, cramming peaked in high school. You can't cram with the amount of material that they need you to know for this exam. There's no such thing as cramming for the EMCA. If you don't know it the night before, you're not magically going to master it overnight. So it's way more effective to just take off don't bite off more than you can chew, right? It's a classic saying, and it works effectively here too. If you really are like, oh my God, for some reason, I didn't study the cardiac system enough. Like, what am I going to do? This is crazy. Don't just read cardiac all night until 2 or 3 a.m. thinking you're going to digest it all. Maybe try and find a small portion of that, take some time, use the strategies we just talked about, and learn some of it effectively. Don't just try and bring everything into your brain, because again, it can't expand quick enough to take on all that knowledge. And when you do try and cram, your brain kind of gets it almost like it's carb loading, right? When it goes into emergency mode, it thinks, okay, Kyle's really prioritizing this information, and this must be crazy important. So say I have a little 5% thing here that's this new information. I'm going to go ahead and erase this 20% over here, because clearly we have to prioritize all of our work and effort on this small information. So you could realistically be pushing out other stuff that you really want to know in order to make room for this new information that you're putting all of this pressure on. So don't cram. You have 2 weeks. You should have been studying for the last month at least. So hopefully you guys have effective times booked for your studying.
Something I will jump in with when we're talking about methods for studying. What I found really effective for the last course I was on, we as a group, and I'm not going to plug another company or anything, but we as a group made Quizlet flashcards. And what we loved about that was through the app, we could literally have them in our pockets. So if we had downtime, even if we were on break, we knew we had an exam coming up, we knew it was an important exam, either we as a class would publish a deck and go through it, or you as an individual can make flashcards for the stuff that you know that you're not proficient in. So for myself, it was a lot of talks stuff, because there's a lot of facts that you have to memorize, and then different meds we'd administer. So it was invaluable to literally have that available in my pocket and just be able to go through. So in addition to the study time I had set aside, this was something that was just accessible. And if I could just as easily pull out my phone and scroll Facebook or scroll Instagram, I could do something that's beneficial to my career and ultimately to my patients. And so that's going to bring me to my next point. It's easy enough. I mean, I would offer that everybody participating in this right now is interested. And I think, in my opinion anyway, everybody's taken a good step to prepare for the A-EMCA. I'm going to paraphrase from a podcast called Heavy Lies the Helmet, where they were talking, I think it's episode 35. It's called Provider Zero. I've listened to it, I don't know how many times now. And I actually, this week, the reason it's fresh on my mind is I wrote a quote on my door at work from it. So The paraphrase is this. They said, if your loved one is lying on the cot in, you know, the helicopter and the ambulance, and they're looking up and it's go time, do you want them looking at you or do you want them looking at somebody else? And if the answer is, you know, you're more comfortable having them being taken care of by somebody else, you probably need to take a step back and reevaluate what you're hoping to bring to the table here, because ultimately the exam is one thing and the exam is critically important and it is a gatekeeper. But I think for anybody you're going to encounter on the road, and Kyle, definitely stop me if I'm getting too philosophical here, but for anybody that you're going to encounter on the road, you owe it to them to be versed well beyond this exam, and you owe it to your profession, you owe it to your peers, and absolutely you owe it to your patients to be as prepared as you can be for real life. And if you meet that standard, yeah, I think you're in great standing for the A-EMCA.
Yeah, that's a great point. Thanks a lot, Joel. That's a really good point. Next on that, preparing for the test right still is a big topic. One of the biggest things you want to make sure you're not doing is psyching yourself out before you even walk into the exam room. Some people get very, very anxious when it comes to tests. Tests anxiety is absolutely real. There's no one who's going to say, oh, okay, just come on, just you're fine. It's just an exam. It's easy for some people to say that, but for others, it genuinely is an extremely hard and challenging time. So even though there's a lot riding on this exam, just recognize that you have the appropriate preparation time and you have the appropriate tools necessary to be in complete control of that outcome. So it's nobody but you who has the full control of how much effort you're putting in before those exam doors close. Right? You're not having a random test thrust upon you on a random Tuesday morning. You have all the ability to prepare yourself and learn as much as you feel ready to do. So focus on what you can control. Be early, be prepared, be ready to react to uncomfortable moments. So when I say that, you're all going to be writing at a different center across the province. Be early is absolutely key. It doesn't matter if it's 9:02 and there was an accident on the 401, so that's why you didn't quite make it in time. The doors are closed. Your exam starts at 9, okay? Don't be that person that's late and tries to fight their way in. Be there early. Account for the unaccountable. Think that there's going to be maybe an accident or there's going to be traffic. There's going to be that idiot in the line up at Tim Hortons that buys 14 breakfast sandwiches and 7 coffees and chooses to go through the drive-through, because why wouldn't they do that? Just do the things that you can control and do them very, very well. And be ready for some uncomfortable moments in the exam. You are not going to get in there and write the exam and think, man, that went so well. Everything went so easy. Why did I even get worried? Why did I even get stressed? This was fine. You're going to be uncomfortable. You're going to read questions where you're like, is this even English? Like, are they even asking me this question? Like, I'm not a med student. I'm not I don't know the answer to this. That's going to happen to all of you because it's happened to pretty much all of us who've ever written this test. There's moments that are super uncomfortable and awkward, and you'll think, should I even be here? Like, what is going on? Make sure that you just use that time to reread the keywords, reread the question, take a moment to breathe, and just focus on what you can control. Don't let that moment deflate your balloon. Don't let that throw you completely off track. Just take it in stride. It's a little bump, jump right back into crushing the exam. Next, we're going to talk about the relaxation training methods. So there's a lot of different things you can do to help yourself with test anxiety and anxiety in general. One of the great ones is tactical breathing. Tactical breathing is used from everywhere from the military. So Joel's probably sitting there just nodding his head a million times. Tactical breathing can bring you back to that grounding very, very quickly. So police officers, snipers, paramedics, surgeons, tactical breathing is very, very beneficial. Meditation, if you've ever meditated before, then meditating kind of so often, even small meditations, just allows you to kind of refocus and bring yourself back. And there's few other mental relaxation techniques as well. If you want to Google those or talk to other people about kind of maybe how they curb their own test anxiety, then that's something that you can look into as well.
So if we can jump back a slide there, Kyle, before you go too far. So focusing on what you can control, What Kyle's saying is absolutely right. I know that I lived this. I walked out and I said, okay, well, I'll find out when the rewrite is and I'll go deal with that. The fact of the matter is, anything that you know, anything that you're certain about, you're not going to think twice about. So when you walk out of that exam, you've already forgotten how well you did on most questions. What's going to be front and center in your mind is going to be everything that you're splitting hairs over, everything that you weren't quite certain over. One thing that I found, and again, many of the students that we've tutored have expressed the same, especially if they're on their second or third right. One thing that throws them off is when you get your lunch break and you're discussing the AM session with your peers, which is natural, it's going to happen. And even though I'm advising you against it, you're going to do it because I did the same thing and somebody told me not to. It can kind of throw you off for the afternoon because you can ruminate on, yeah, got that one wrong, got that one wrong, got that one wrong. The fact of the matter is you just answered so many questions in such a short order. You may not with certainty be able to say that you got it wrong. But the other thing is, when you walk out of that, the answer's on the page. There's no going back. So it is what it is until you get that result. So
exactly,
best thing you can do is take your lunchtime for you. Yes, you're going to talk about questions, and I know that, but try not to ruminate on them, especially because you don't want it throwing off your afternoon. It's like any sport, you know, the last period, the last half, the last inning, whatever. It doesn't set the tone for your next one unless you let it. When we're talking about tactical breathing, I know it's something that's got a cool name, and I know that Kyle is kind of joking, but it does, as a matter of fact, work. And the reason for this is when you're consciously focusing on your breathing, it is impossible for your sympathetic nervous system to take control. If you decide, I am breathing, this is where I'm at, I am in control here, it forces you to come back down. And quite honestly, like this, you can imagine that being a military medic, and certainly at the time having experience in the military, by the time I went to paramedic school, you can imagine that I've been exposed to some fairly stressful situations, but I did find this to be more stressful than some real life things because it has very, very real life implications, you know. So it does absolutely work. You don't have to, you know, look around and make sure everybody in the room knows your tactical breathing, but just very quietly, 4 seconds in, hold it for 4 seconds, out for 4 seconds, bottom of the breath for 4 seconds. And if you do that 4 times, as stressed as you are, you'll be able to step back out from that. You'll be able to focus a lot better, reframe, and keep working.
Yep, that's exactly it. Thank you. Okay. Okay. So the night before is a very important night, right? So you take the time you have from the weeks/months before your exam to really digest, understand, work through, challenge, critique all of your notes, bring on all this information. But the night before is the one that really is that make or break, right? So a good night's sleep is more valuable than cramming subject material. A good night's sleep is what's going to allow your body and your brain to really perform in the exam. You're not going to be able to perform trying to crush your second Red Bull because you're up till 2 a.m. learning random things from a study about cardiac output. Like, you don't need to do that all the way up until the night of the exam. It's just not going to benefit you as much as you think it will. A good night's sleep is hands down way more important. You also got to remember that good nutrition is also important and is an essential for optimal brain performance. So late night pizza, some chips, a couple beers, and a morning Pop-Tart on your way out the door to write is really not helpful. So I'm not here to be your dietitian. I'm not here to tell you how you should live your life. It doesn't affect me how you choose to eat. But if you want to actually do well and perform at optimal levels, it's been proven over and over and over the type of nutrition that's important to do that. Essential hydration, the right vitamins and minerals, all of this in your diet, not a ton of carbs, not a lot of fatty foods because your body's working hard to digest and work on those, and your brain isn't getting that key nutrition it needs to be functioning as well as it could be. So do your best to try and give yourself all the best chances, and have a good nutritious dinner before. Wake up early in the morning, have a big glass of water before you crush your coffee. Have some kind of actual good substance for breakfast, like oatmeal, yogurt, fruits, a shake, something that's actually going to fill your stomach, number one, but also provide you with good nutrition to last you at least through that morning session. And hopefully you have a good lunch and snack to get you through the afternoon as well. So when you're studying, obviously try to avoid it, but especially the night before, avoid the use of alcohol and drugs, as it can interrupt your sleep patterns, as well as make you more tired the morning of the test. You want to be sharp as possible. You want to be able to convey all the work and effort that you've put in to learning the material. You want it to be able to come out easily. You don't want to be foggy or possibly even a little bit hungover because you maybe had a couple too many while you were trying to ease the stress and ease the anxiety and whatever you wanted to do the night before. So just do your best to try and keep that mind nice and clear. So remembering preparation is key. So I guess one of the questions that a lot of you are probably asking yourselves, or you wouldn't really be here, is that how do I get it right? There's lots of ways to ensure that you're doing everything you can to score highly on standardized exams. So the two types of questions that you're likely going to see, scenario-based questions. So all the information is given to you in a scenario. So it's a paragraph that just explains, this is where you are, this is what you're doing, this is your patient, this is why you're called. Don't think that information is ever implied. Only use the information that they've given you in that paragraph. Okay, so just read what they're giving you, take the time to read through it, understand what they're asking, and then answer the following questions based on those scenarios. Now, on the other side, you may see some standalone questions. So standalone questions may be present alone, and they're simply testing that knowledge or ability to critically think. So you really need to be careful when you're reading the questions. You may be involved in a scenario, for example, that is all about bronchoconstriction. You're talking about the bronchoconstriction pathology, the pathophysiology behind it, how it works, what medication you may give, blah, blah, blah. The next question may simply ask, what is your dose of epinephrine for an allergic reaction? So that's not related to your scenario. But if you read it too quickly and you think, oh, what's my dose for bronchoconstriction? Yeah, okay, it's blah, blah, blah. Epi obviously isn't the best example because the doses are really similar. But what I'm trying to get at is ensure that you're reading what the question is actually asking you for, because they may do question 9 through 14 relates to the following scenario, and then question 15 is a standalone. But it may be asking something that if you don't really catch and read the question about what it's asking for, you may still be in the thought process of what you've been applying for the last 5 questions. So just make sure you take the time to look at, okay, it'll always say the following scenario applies to question 7 through 13 or 28 through 31. So see where you are and see if you are expected to use that information to apply to the questions they're asking you. So just take your time going through the exam. So in a scenario question, information's given, and then more information will be provided throughout your progress in order to account for reassessments, changes in patient condition, and new findings that you would realistically have in a real patient interaction. Information you're expected to know that has already been given will not be restated. So because they gave you medications and things like that at the beginning of the scenario, they're not going to say it later on, 3 questions later, when they do their next update of paragraph, even if after that paragraph they ask you about how would you like to treat this? Okay, well, you know what? This person's having chest pain. This sounds like it would be a good time to give ASA and nitro, blah, blah, blah. Their most recent vitals are X, Y, and Z, but you forgot that their first blood pressure, for example, was hypotensive, or maybe their first heart rate was outside of the parameters. You need to remember the information that they've given you at the beginning all the way through in order to appropriately treat and appropriately answer these questions. So look for allergies, look for previous vital signs, think about contraindications that they may be kind of lining up for you, okay? So another thing that you can do on a strategy we use is looking for clues to correct answers based on information that's actually given within the question itself. So whether it be within the question description or possibly one of the first couple questions you get, you may actually find some information that's pointing you in the right direction. So looking for clues towards that right answer. So you may find dosing or other relevant information in future questions, but remember, you don't go back to change your answers if it's new information. So just because in the new reassessment, they've updated some information that should affect you moving forward, don't go back and change an answer because they didn't expect you to have that information when they asked you the original question. Okay. So if you answer question 21, 22, and 23, and then they do a reassessment on Jim, and now you think that that new information would actually change how you treated him, don't go back. They wanted you to treat him based on the information that they gave you originally. Okay. So just don't go back and change it based on new updated information. So now we're going to get into some of the actual strategies that we believe are going to be the most helpful to go through and utilize when you're writing the exam itself. So we're going to be going through 7 proven strategies to help you perform your best and get you the best mark possible through these next 7 slides. So number 1, some people love the idea of skimming with a highlighter. They're going to skim through, highlight a name, a vital sign, a medication name, this, that, the other thing that they think is critical information. What we want you to do, as long as you are comfortable and confident in your ability to read through this exam in the amount of time that's given, we think it's much better for you to read every word. Read the entirety of this scenario that prefaces each set of questions, as it's going to allow you to build a mental image and draw a situation that they're trying to expect you to be in. You may even actually be pushed back into a similar personal experience that you had in the past. So say you did a call with your preceptor or you went through a specific scenario in school, they may be giving you information that makes you think right back to that moment. And then you can really visualize, oh, this is what we did here on scene. This is how we treated this patient. This is how I spoke to this patient. Okay, you know what? I can actually answer this because I've been here before. So don't just make it a little pick and choose kind of just messy situation. Let them actually build the program and the picture that they're trying to submerge you in, and then just kind of find yourself there. Like you can almost visualize that you're on a call based on the way that they're presenting it to you. So take that time, get yourself to that call in your head, and then you're going to be able to go through those questions easier. The scenario style ones. Another way to find success is taking small breaks. So taking small breaks allows you to ground yourself, reset that train of thought, and the key is brain dumping. So being able to brain dump is going to be so beneficial for you when you get through this exam. So every different scenario, you should take like 20 to 30 seconds of just don't even start reading the next one. Just breathe. Okay, you know what? Sweet. I am done with cardiac. I'm done with treating with aspirin and nitro. I don't want to talk about another STEMI. Okay, sweet. Catch your breath, refocus. Okay, what do we got next? And then dive into the next one. Give it that 20 seconds or so, even just to take a small break. Think about what you've kind of gotten through. You can close the door on that piece of information for now, and then move into whatever the next room is, right? Move into whatever the next task is. Think about it like a workout. You're not just going to do 50 bicep curls and go straight into 50 push-ups and then go straight into 50 tricep extensions. That would just be asinine and your body will shut down. Treat this test like that.
Maybe you're
You
not.
can do, go ahead.
It's a joke. I said maybe you're not.
All of us, we're not all military guys. We can't all just do that kind of stuff. $6 million man. Think about it like a workout. Take that moment to really recenter, rest your brain before giving your max effort on the next question set. You don't want to be kind of steadily declining because your brain is fatigued. You want to take small breaks, refocus, recenter, and then be at 100% for the next set. Be able to recall fully what it's asking you. Another one, skip time suckers, but don't jump around. So with a timed exam, ensure you're not spending too much time on a single question or a single problem that's really causing you problems. So you really are stuck between three answers and you don't even know how you're going to start narrowing it down. You're not too sure about which one to eliminate. You're not too sure. Just put a star beside it, skip it, get it out of your head, and return to it later. So that's the skipping part. When we say don't jump around, we mean if you skipped question 23, don't get to question 60 and then think, oh man, yeah, I didn't do 23, and then jump back to 23 and then jump back to 61. Work through the exam front to finish and then go back to the beginning and then go through all of your starred questions. Okay. So make it always just go through one way, one direction. You're going to find yourself possibly answering or clarifying a question later in the exam that could actually give you an answer to that question, right? If you're working through a single scenario, they may give you a question later on that actually helped you make the determination of what you were worried about the first time. So flow front to back and then again front to back. Don't go front to back and then back to front and then front to back. Do it in a flowing, single moving way. Okay. And I think Joel wants to jump in.
Just if you are going to skip a question that you're really splitting hairs over and it's taking some time, be sure where it is relative to the Scantron sheet, because the worst case scenario is you accidentally displace all of your bubbles by one or two questions, and then you have to chase them down and figure out where they're supposed to go. And unfortunately, that has happened, and the candidate unfortunately ran out of time to correct it. So it ended up being a rewrite. So if you are going to skip questions, make sure you have some sort of system to ensure that you follow through on your Scantron sheet so that you can put your appropriate answers where they're supposed to be.
Yeah, and I think it would actually be a great segue for Max to jump in with one of the resources and kind of the ways that he's used in the past for exams. It's something that I do as well. So one big thing that we really want to hammer home here is if you have found success on exams going through college all the way or going through university or anything, don't completely change how you're going to write an exam and feel stressed about how you're doing it because you heard it here today. We're trying to provide you with some of the best strategies and some of the proven strategies. But if you think that something works very well for you, don't just change everything up. It's just like a golf swing. Just because somebody has a golf swing that is picture perfect or textbook is different than someone who, you know what, it might not look phenomenal or it might not be the same as mine, but if they're still hitting it 275 down the middle every single time, who am I to judge, right? If you have a strategy that works for you, that might not be exactly what we're saying here, don't change everything about it. Just add some things in that might benefit you to improve your chances and strategy. So Max, if you want to jump in about how you kind of go through the exam and then Scantron at the end.
Yeah, so I'm a very fast test taker. I just sort of fly through things. I just go with my gut, actually. So what I do, because I'm not a slow test taker, this won't work if you go right to the last second. What I do is I push the Scantron aside. I don't even think about it, and I'll go through the test front to back, and I circle like my answers on the actual test sheet. So that doesn't count for the A-EMCA. You do need to transfer it to the Scantron. But once I'm done on the physical copy of the exam, then I'll take my Scantron, move it over, and I slowly go over and read the question again, make sure that I agree with my answer. I very rarely go back on it. And then I transfer it over. Once I'm done with the transfer of the 120 questions, I go back to the Scantron alone, and I make sure that I didn't miss a bubble or I didn't double up on bubbles as well. And this just ensures that I'm confident with my answers, and it just sort of saves me time instead of reading a question and then having to focus on bubbling it in. I can just sort of go through it, keep my head in sort of exam and question answering mode, and then focus on transferring things over after. It's effective for me, but that's just because I'm a fast test taker. I know my friends, I suggested it to them, but they don't have the extra time to do that. So if you don't have the extra time, I don't suggest it. But if you're someone who's able to hand in their exam earlier, or if you have time to try this out with practice exams, or just if you're still in college and still doing exams, maybe it's something you can try out as well. I don't know.
Yeah, it's a really good point, and a good method for, like you were saying, if you're someone who's confident in when you're going to be finishing. I don't think I ever finished in either PCP or ACP with any less than half an hour left in the exam. So, and that was with using this method. So by no means does it mean race through the exam so that way you can then do Scantron later. It's do the exam at your speed, and if you feel that you can get through it and have this second wall of checking and confirming your answers, then that's a good way to do it. Because one of these things is it's kind of on continuity, right? So neurological continuity shows that if you have one test in front of you and you always stay focused on that document and exam, you're not actually breaking your concentration to, okay, 32, yep, see, cool. Even though that seems like a small thing, you are breaking your concentration every time that you're doing that. So if you're in the middle of like a scenario question and you're kind of really cooking going through this question, you're actually distracting yourself a little bit more than you may think you are. So it can be really beneficial to just even do, if you don't think you can do the whole exam and then do the whole thing in the Scantron, even do it scenario by scenario. So go like 31 through 38 and then read through. Yep. Okay. Sounds good. And then go to the Scantron 31 through 38. Right. So almost a hybrid. So like we were saying and how I prefaced it, don't change everything to where you're going to be just scared and rushing and don't really know and you might run out of time. But if you think this is something that fits for you, it's really been beneficial for Max and myself. So
Yeah, and try it out. And if you're still in college and still have like exams to write, try it out then. Try it out with like the practice exams if you have any. We offer them. So just try it out before you go into the MCA and try this whole new method, and maybe you don't have time to
exactly.
actually do it.
Exactly. Awesome. Thank you. So next, process of elimination. I'm sure everyone's utilized it in some form or another, but knowing that process of elimination really does allow you to narrow down questions to only remaining possible correct answers, but you really want to ensure that you're only eliminating those that you're 100% sure of. Sounds implied, but trust me, it's easy to think, oh, I don't think that's accurate. No. And now you've gotten rid of one of the multiples that goes with the right answer. So now you've really put yourself behind the 8 ball. So if you're going to eliminate an answer or eliminate one of the partial answers, make sure you're 100% sure of that. Okay. So if a question is brand new ground for you, or you really don't know, you're really not comfortable with this material, if you can eliminate one answer, you now have a 33% chance of guessing versus 25, right? So no one wants to say, I guessed on number 34, but if you have to guess, you have to guess. Just don't ever leave an answer blank. It's always better to guess and try and play your odds than it is to just not put an answer down or just guess 1 out of 4. You should be able to narrow every question down to 2 realistically. And then from there, you're 50-50. So never change your answer with a question mark. Some people say, when you're doing your test, you've studied hard for it, go with your gut. Go with your gut's a great strategy. However, it will be impacted if you have the inkling to change your answer. So it doesn't mean reread it and think, how could I change my answer? And then try and convince yourself to change it. It means if you kind of go through this again and you think, oh, I didn't even read the fact about her also being prescribed Ventolin, or I didn't read this before. Like if you have new information that should impact your decision, then don't be afraid to change it. So there was a study done in 2005 in, I believe, the UK of 1,500 students. It showed that when they did change their answers, they went from wrong answer to right answer 51% of the time, and from right answer to wrong answer only 25% of the time. 23% of the time with a changed answer, it was wrong to another wrong. So think about that. These 1,560 people, 51% of the time, so a majority of the time, they went from wrong to right. So if your brain for some reason is telling you, no, I really should switch this one, then trust yourself. There's a reason that you think it should be switched. So your gut can be trustworthy, but just never slam and lock the door shut when you do have new or good logical grounds to want to change your answer. Scantron patterns though, man, like I have 4 Ds in a row. There's no way that it could be a 5th D. Well, that has no bearing on what the actual answers are. And sometimes testers, I don't know if they will for sure in the EMCA, but I can guarantee you that I had university professors that one guy actually put 7 Cs in a row because he just wanted to see how many people would be like, oh, it can't be 7 Cs. There's no way. There can't be 4 Cs in a row. It must be another answer. He did it on purpose just to kind of play with the psychology of an exam. So don't think that Scantron patterns is what's going to make or break your right or wrong answer. You need to go through the question, go through the possible answers, use your information, your intellect, your experience, your knowledge base to make you choose the answer that you think is best. It might not be the right answer, but it's the answer that you are going with, that you are choosing. Don't be like, I'm really confident in D, but I've already got 4 Ds in a row. That's not going to change it. So don't let that really shake you. Okay. Go based on what you believe is the right answer on your own experience and the way you're reading and understanding the question. And the last one here, never add or assume any information. So always use the information that's given within the scenario description. Don't think about implied situations or expected outcomes based on things that are explicitly said. So if you have a patient who is in an MBC, they hit a tree, but it turns out that they really only went into the tree kind of due to a cardiac event, for example. If you're thinking, oh, MVC, they definitely have a C-spine injury, so I'm going to make sure that I'm going on a trauma bypass and it's going to have these kind of injuries and I need to make sure that I do all these things. Well, you didn't really take what they were asking you in the question. Don't just add things in, don't just make things up because you think it's a good idea. You have to explicitly read what's being said to you. So just don't get ahead of yourself and don't allow yourself to build up the scenario or the situation in your head. Really read it, like Joel said it great earlier when he was talking about the ethical questions, when he said read it with a very monotone and kind of chill tone when you're reading things. Don't put a lot of emphasis on different little areas. Just read everything very, very calm. Read it through and then understand what they're trying to tell you and explain to you. Don't let yourself get all hyped up and be like, oh, and this and this and this, and I have to do this protocol, and then I'm going to go on this bypass. Just give it a second, work through it, see what they're really trying to let you understand, and then go forward from there. Also, think about conditions that they have based on their medications, right? They may not say to you, Jim has diabetes, hypothyroid, and cholesterol issues. They're going to say, Jim's on metformin, he's on Lantus, he is on hydrochlorothiazide, he's on Crestor and metoprolol. They're going to give you the medications and you have to know what those medications are for. They're not going to give you random trial drugs from a random country, right? They're going to give you the most common, most expected meds that you will have to know about, right? Like metoprolol and calcium channel blockers and different diabetes medications, those things that you should be very comfortable with. But make sure that you're understanding if they're giving you meds, then that means that they have conditions. So think about what those conditions are and how they're going to play into your call, how they're going to play into the way your patient should be presenting, or maybe they're not presenting in the way that they should be, and that's a problem, right? So someone who's on a water pill like a hydrochlorothiazide, they're going to have some edema somewhere. So maybe if we're hearing some kind of crackles or it's becoming more of a cardiac issue, then we're thinking, okay, well, maybe this person really has a CHF more than just some swelling in the ankles, right? So think about those things and really add those things into your assessment of the situation and scenario. So those are the 7 strategies that we really wanted to get across. Okay. And next, we're going to go through some practice questions.
Sorry, just while you're loading that, Kyle, there's a great question in the chat, so I just want to draw some attention to it. The question was, is there a list shown with common medications that we can see? There's not. We could probably look at generating one or building one. We're actually in our online subscription working on building a pharmacology for patient meds. because a lot of people were asking about PCP meds, and we have done that. It's just now people want to know about what is common on the road. So what I would advise, be comfortable, like Kyle said. Oh, sorry if the fur missiles go crazy here. Sorry.
The beauties of live shows. We can't control some of the excitement that the pets are trying to contribute to the success of everybody in the course. If Joel has anything to add, he's going to type it out, which is great. So watch for his message in the chat box, please. But the best thing that I can say is to kind of go through some of your own calls, some of the calls that you're doing on the road, some of your most common calls, right? So your cardiacs, your CHF, your diabetes, things like that. And then look, you can even Google it or however you want to go through it, but Google some of like the top medications for X, Y, and Z. So the most common medications, or you can search most common prescriptions in Canada. That actually does come up, and there's 200 of the most common prescribed medications. So you'll see what their generic name is, and you can also see the brand name, because they may give you both, right? So just kind of, it's as easy as it is for me to say, oh, just go look them up. That really is the best answer right now. Like Joel said, we are working towards building something like that, whether it be a Quizlet or something, but it just doesn't exist right now because it just wasn't feasible. But do your best to do your own kind of reading. I know Max wants to jump in and say something. He may have a great resource. I'm not sure.
So what I did when I was writing out actually is every time a patient came with a giant, freezer bag full of their medication, I had my little notepad. I wrote everything down. Maybe I didn't know what everything did. But after the call was over, I'd go on my phone, my laptop, and I'd look every medication up. What the other name was, what the pharmacokinetics, pharmacodynamics were, mechanism of action, as well as I made like flashcards on them. And then also sometimes if it was a really big medication like a digoxin, my preceptors actually would, between like commercials on their shows they were watching or at base, they made me do a presentation on it, just like a little like 2-minute thing, and I'd present what the medication was. So if you want to do that like with friends, you take like, oh, I'll do like antihypertensives, and you can do like, I don't know, like diabetic medications, come together and create like a list and do like presentations with each other. So that way you don't have to go through cardiac, endocrine, neuro, like all the drugs yourself. I think I do have pharmacology textbook that I can write in the chat what it is, if you'd like.
Yeah.
One I would recommend. Sorry, now I got the boys under control here. I would look at generic names. Very rarely, if ever, will A-EMCA use trade names. And the other thing is, by looking at generic names, a lot of times you can look at the suffix and determine what class approximately it belongs to. So for example, Olol would be your beta blockers and so forth. So if you're familiar with that, you're already off to a good start. One, and I can't say, because I mean, I have no way of knowing what would be on the A-EMCA, but semaglutide, otherwise known as Ozempic, is really popular right now, or fairly popular anyways, for diabetes treatment.
For weight loss. A lot of people are for some reason taking it for the weight loss side.
Yeah, potentially. So yeah, I mean, it's not indicated for such, but I mean, I wouldn't put it past some folks, because in treating diabetic patients, they're commenting like, wow, this is great. I have shed a few pounds and I didn't mean to, but this is great. So and that's one that I'll plug, just because I wouldn't be surprised to see something like that on there. But definitely I would go generic names. Have a working understanding for when you're on the road of what some trade names are, but generic names would be the way to go if I were to give you any advice at all.
Another good one is the EMS Pocket Drug Guide. You can get it on Amazon. It's a little tiny like white book that you can actually fit in your pocket of your tack pants kind of thing, and it has a ton of drugs in there, their classification, as well as what they're used for, all sorts of stuff. So it's actually made for EMS. So that's a really good one as well, which is nice. Also, by no means is it something you guys have to do, but if you do decide that the online membership is something that works for you and will help with your studying, in the pharmacology area, we do kind of break down some of those and then have a full description of all the suffixes at the end. And then we talk about some common medications as well. So it's something that does exist. Again, we're working towards building a not comprehensive, because there's a million medications out there, but a much more descriptive list that we hope to provide to all students as soon as we do have it ready. So thanks so much for bringing up that point. I wish that we did have one for you, but we just don't right now.
Last point before we move on from that, one thing I would also strongly encourage, whenever you have a medication within our scope of practice that is immediately contraindicated by a patient using another medication, be very, very familiar with what those are. One that comes to the front of my mind would be with NSAIDs, patients on anticoagulation therapy. You should be very familiar with what does and does not constitute anticoagulation therapy, because that can change the trajectory of the question completely.
And remember that antiplatelets are not anticoagulants. Okay, so moving forward, we're going to go into our assessment activity. So we're going to jump into a little bit of assessments. So some practice questions. So Katie, I'm just going to have Joel answer you directly, just with a little bit of the stuff that we do have available. Okay. So I'm going to be dropping my chat box just so I can read the full questions here. So Joel and Max will be keeping an eye on that for us. So here's a scenario example. We're going to have you guys all read this, and then we'll move to the first question. So we're going to go ahead and go to this first question. So first question, which of the following are typical in an acute asthma attack? So which of the following is typical in an acute asthma attack? Remember, you can use a couple different strategies. If you are sure of the answer 100%, then you go with it, right? You circle the ones. So this is one of those multiples like we were talking about. You have multiple options, and then you have multiple choices to choose a collection of those options. So what you want to do is work through it, determine which one is the best answer and why you feel it's the best answer, whether that be eliminating some answers or only circling the ones that you're sure of. And then you get to the right answer at the end of the day, which is answer 4, 2, 3, and 4. So that is talking is difficult due to the bronchospasm. Expirations are wheezy and prolonged with forced effort, and mild temporary relief may be obtained with the expulsion of mucus plugs. Great. So next question. So you find Brad to be in acute respiratory distress. The specific patho process that is responsible for the acute respiratory distress given by an acute asthma attack is which of the following? So we'll give you guys a minute to read through these. So remember, whatever strategy you're choosing to use, whether it be elimination method, or I'm super sure of 1, or I'm super sure of 2, then use that to determine which one you think. So for example, we can kind of use this strategy when we look at the available answers. It looks to me like number 2 is available in 3 of the 4. So if I really agree with that, then I can eliminate any answer that doesn't have 2 in it, for example, right? So if you're sure of 1, you can eliminate the answer that doesn't have 1 in it, right? So you just work through it however you want to do it. You attack it from what you're 100% confident of or what you're 100% sure is not accurate. So after we work through this one, we find the answer to be 3. 1, 3, and 4. And the reason that some people get tricked up on this one, why 2 isn't the correct answer, acute asthma attack is not dilation of the bronchioles, right? It's constriction of the bronchioles. So we want to ensure that we're really reading these questions closely. If we start to kind of skim through, yeah, you know what, bronchiole sounds good, inability to contract, yep, smooth muscle, yeah, it hits all the right talking points. We want to make sure that we're seeing exactly what words they're using to ensure that they're not giving you the exact opposite of what you should be expecting. So for this one, the correct answer was 3. So here's what we're speaking about in a patient update. So you had the first paragraph, then 2 questions, and now you have a patient update. So there's another little bit of information to add to your situation or scenario. So you recall which of the following are relevant to this situation? Okay. Give you folks another 30 seconds or so. And remember, just keep track of which one you're thinking, just so that way you know where to study, right? You can use some of these wrong answers as that place to jump into your studying a little bit further. So the correct answer here, 2. 1 and 2 is the correct answer. So we know that an infection is likely to have caused local edema, which is going to contribute to the obstruction of the bronchioles, right? So we have the natural increase in mucus production with an asthma attack. And then once we have an infection on top of that, we know that we're going to have that white blood cell and that immunology response that's going to in turn create more junk in the lungs, right? Kind of a pneumonia type reaction. So that coupled with the asthma is going to be very, very difficult for the bronchioles to fight through. And then we know that 2 is also correct. So the infection could have caused an allergic response, right? We know that 3 is not correct. So we can immediately eliminate 3 and 4 because it says Ventolin will have an active bronchoconstrictor in the medication. No, Ventolin is a bronchodilator. So as soon as we see that word, we can immediately eliminate it. So now we know that we're just dealing with 1 and 2 as the potential answers. So using those little strategies together, now if you for some reason are like, I don't know if it's 1 or 1 and 2 or just 2, right? So you're stuck between answer 1 and answer 2. Now at least you have a 50% chance instead of a 25% chance, right? So just using these small strategies. Remember, we want to read this question closely. Think about developing COPD. COPD is a respiratory disorder, right? Do we think it has anything to do with drinking, really? Probably not. So we can eliminate anything that has the answer 2 in it. So we can immediately eliminate 1 and 4. And then the only difference there between 2 and 3 is number 1V, right? Number Roman numeral 4. Smoking pattern of approximately 2 packs a day for over 5 years. That probably has a little bit to play into a COPD situation, right? So I think that the best answer is pretty obvious. It's 3. So 3 and 4 work here. Okay. And last one here. So you know that emphysema involves which of the following? So again, these questions are obviously going to be challenging your understanding of COPD and emphysema and things like that. But we want to make sure that what you're really focusing on is how to work through the question. If you know it, amazing. If you know it, that's great. If you don't know it though, how are you going to try and get through what this question's asking you? Because if you don't know it, you can't just cross the question out and write a note that says, sorry, I didn't know this one, just take it off my exam, right? So you want to make sure that if you aren't really 100% positive, you know how you can give yourself the best chance and the best strategy to do this before. So as you guys are reading, there was a quick question in the chat there. If there is more than 4 answers to choose from, possibly on the A-EMCA, yeah, there can be A, B, C, D, or E. So there's usually 5 options. It can go up to 5 options. Okay, so for this question, the correct answer is all of the above. All of the above. So if you feel that you didn't do as well as you wanted to through those questions, I highly recommend you do a little bit of a COPD review in the next 15 days. Okay. So I really hope that you guys were able to get some value out of this. I think that we had some really great points brought forward from the instructors today, but also some really good questions and points brought in from you all in the audience. So thank you very much. If you have any questions, I really encourage you to ask now before we're all done. If you can't think of anything right now, you can always reach out to us on our Facebook Messenger group, or if you send an email to info@medicsense.ca, we'll get back to you as soon as we possibly can in either of those 2 domains. So as a thank you for you guys coming out and taking your time today, we're going to be offering 50% off of this weekend's live virtual A-EMCA prep seminar. So this is one that is going to be really beneficial for those writing on the 15th, as well as those who, if you're writing in June, we do have a few dates that are going to be released tomorrow for April and May. So if you are thinking, you know what, I probably am going to want to do one of these EMCA preps. If you like the information that you've gotten, the way it was delivered, and the kind of insight that you got from the instructors today, I really think that you're going to find a lot of value from that full 2-day preparation seminar. So we go top to bottom with all the topics that you would expect to do on your EMCA. So that list that is given by the MOH of all of the topics, we have presentations and descriptions of all of those. At the end of that A-EMCA prep seminar, you do our 110 question mock exam. That mock exam comes with full descriptions of all of the questions. And we think that it's a phenomenal product. We've had a lot of great feedback on it. So if that is something that interests you, you get 50% off for this weekend coming up. But if you do choose to register now, we are going to be honoring that as a registration for all of 2023. So say you're someone who's writing in June, or you're someone who's writing in October. If you register before February 28th and use that code, we are going to give you that 50% off value, because we just want to say thank you for taking the time to come out. And we really hope that it's something that can help you get past this exam. Your schools do a phenomenal job. You guys have great preceptors, but sometimes it's great to have that good consolidated all in one place response and preparation ability. If the live doesn't work for you, or it doesn't work because of your schedule, or you're really not someone who wants to do 2 full 8-hour days, we are also doing 50% off of the digital access products. So you can get a 3-month or a 6-month membership with access to the mock exam. Do it as many times as you want. Use that coupon code virtual23 for all of that access. That expires February 28th. So if that's something that does interest you, please take advantage of it. If not, then that is absolutely fine. Everyone learns in their own ways, no matter what. I'm really, really happy that you guys took the time to come today, get the experience, ask the questions that you wanted to ask. And I really hope that this had a lot of value for you. So thank you so much for spending some of your Tuesday night with us. If you have any questions, please feel free to reach out. And with that, I wish you all the best in your consolidation, your education, and hopefully soon we'll see you on the road. Take care. Thanks so much.